family. Welcome to this edition of I'm Not Crazy But. I am Dr. Rhonda Mattox, your I'm Not Crazy But host. Family, when I was knee high to a gnat, my family didn't talk about hypertension or diabetes or depression. They talked about the sugar, blood pressure, the pressure. They talked about going crazy. They talked about all of those things. And that didn't sound crazy. It didn't sound like the boogeyman per se. They continued to live their lives just as they were, eating orange sliced candy, cherry sours, sweet potato pie, lemon Jackson cookies, you named it, they ate it. No lifestyle modifications, no nutrition changes, no exercise. They kept living life as they had been living. And to me, you just took that little orange syringe and it made everything better. But I kept living. And when I reached my young 20s, those same individuals were losing their eyesight. They were losing their limbs. They were losing their independence. They could no longer travel however they wanted to. They were now changed to dialysis machines and they had lost their independence. Why am I telling you this? Because when I hear terms like chronic kidney disease, it didn't mean anything to me. It really didn't, even as a physician. And it wasn't until I started to learn about what caused chronic kidney disease that I even realized I had been impacted by it. When you have conditions like diabetes, hypertension, repeat kidney infections, those kinds of things, that can do some serious damage to your kidneys. Now, listen, I didn't even realize that my mother being on dialysis increased my risk. You may not realize those things as well. That's why today we are talking about living life like it's golden with chronic kidney disease. Now, for those of you who think chronic kidney disease is dialysis, that does not sound right, but that's not all that chronic kidney disease is. And today, that's what we will be talking about on I'm Not Crazy But. Now, I have some amazing guests with me, and as I'm introducing them, I do want you to start dropping your name in the chat and repping your city and sharing. Because if you know anybody with diabetes, high blood pressure, or let me say it like they would say it, the sugar, pressure problems, any of those things, this is a show that you don't want to let them miss. Why? Because we are our brother's keepers. And you know as well as I do, particularly as women, we are serving in caretaker roles in ways that we've never done before. And so you want to make sure they know how to prevent and live with, because likely if you live long enough, you'll be living with them as well as they are navigating chronic kidney disease. So let me tell you about my all-star cast today. They are an amazing, dynamic group of women in our very own Dr. Keith Fletcher, who's a CEO and founder of Key Fit Life. Now, family, she looks fantabulous right now. Let me tell you, this is 70 pounds later. She lost 70 pounds on her own through her commitment to fitness, grew into passion, and she founded Key Fit Life. And now she's helping people radically change their life through developing healthier habits and becoming fit in mind, body, and spirit. Not only do we have the amazing likes of Dr. Keith Fletcher, we also have the Dr. Annette Sims Slater, who is the general in psychiatry. She has been doing this thing for more than 2 decades at the Veterans Affairs healthcare system in various positions, serving our veterans. She is an amazing mentor, wife, first lady. She knows how to mix faith with actions to treat this. And moreover, we also have the Marquita McField, who is a licensed certified social worker. She is a person who has a bachelor's degree in psychology and linguistics, and she uses that linguistics part to infuse hope into her messages. All of us on this virtual platform have been impacted by chronic kidney disease, even though we didn't realize it at the time. And let me just tell you, God was up to something when we were pulling this together, because I was doing this, I thought, because it was the right thing to do for my dear mentor who is really working this. But as I talked to each of these individual ladies, what I realized was that each of them had been impacted very powerfully by chronic kidney disease. And I am here for it. So we'll start with the obvious question, which is what is chronic kidney disease and how does it impact us? And of course, I'll probably let the good doctor start off with answering that question, and I'll chime in, and the rest of us will chime in as well. But let me just say what I'm not going to do. We're not going to talk about stuff like the stages of kidney disease. If that's what you're here for, you're in the wrong platform. We're not going to talk about glomerulus and GFR and that kind of stuff, because what we are really truly talking about is talking to the individuals who are loving and living with chronic kidney disease and how to live their life like it's golden. And let me be crystal clear on this. We are going to also have fun while we're doing it.
Well, thank you, doctor. I can definitely say that this is probably one of the most common illnesses that we in psychiatry have to deal with, because chronic kidney disease simply means a progressive decline in kidney function. And kidneys have an extremely important job in our bodies. It is supposed to filter our blood and get rid of the waste products that comes along with our everyday living. It gets rid of the waste products from the food we eat, or from the pills we take, or if we breathe in toxins from the air, or even from just the breakdown of muscles when we work out. And if the kidneys are failing in the ability to do that, then you would expect to start having some symptoms. The problem is that we don't actually start having those symptoms, and usually until we get down into the moderate to severe stages. And I have to say at least two words about stages. Normal, when you go to the doctor and they take your general blood, they're going to do a GFR. And all that tells you is if you are filtering the waste products from your body in a normal rate. As that rate begins to drop down, then the number gets lower. But obviously, when it just drops down just a few points, you don't feel anything. Mm-hmm. And we have a really bad habit of not going to the doctor unless we feel sick.
Oh my God. Yes.
Unfortunately, you may be all the way down into the moderate to severe illness before you actually have symptoms. And that's why they say, well, that's why the literature says, not they say, that approximately 80% of the people who have kidney disease don't even know they have it. So I'm going to say, essentially, it's when the kidneys stop doing what they're supposed to do, and unfortunately, it's progressive. And if you don't get treatment too far down the road, it can also be irreversible.
We can't hear you.
The key point of what you said is 80% of people who may be living with kidney disease may not even realize that they have it. And so that makes a wonderful case for why you should at least visit your doctor once a year, particularly if you have kidney disease in your family. And you may not think of kidney disease as diabetes or high blood pressure or what have you, because you want to hear kidney disease, but that's not the case. It's diabetes and different things. So as we're talking about this, why in the world would a couple of psychiatrists and a social worker and a fitness instructor be convening around chronic kidney disease? And the reason for me is fairly simple. As a psychiatrist, many times I'm one of the first people who will even identify that diabetes is a possibility, because many times diabetes does not present in whatever way it is that you think it presents. Yep. Many times it presents as actual depression. You're feeling lower, your mood is lower, you don't have energy, your appetite has changed, you may be sleeping more, your concentration is off. And so people come to me thinking, or to us sometimes thinking they have diabetes. And when we do our workup, we are able, or not diabetes, but depression, when they do their workup, we're able to say, you know, you have some,
Mm-hmm.
this is an issue and we need to get it treated. And many times after the diabetes is treated, the depression is treated and they no longer need to see me. So that is something that we see a lot. But the other piece is that chronic kidney disease, particularly in its later stages, can be very isolating. And so people are not getting out and about because maybe they're tied to that dialysis machine. How do you live your life like it's good with chronic kidney disease before you get to dialysis and even afterwards?
Dr. Maddox, one of the things that you and Dr. Slater say that is so important that keeps ringing in my head is really two things: how I feel and myself. It makes me think about the whole idea of that your feelings are valid, but they're not always factual, right? Like, just because, I mean, that's every day with working out. I don't feel like working out every day. Even though I'm a fit, I don't feel like it, but my feelings are not necessarily fact. I know that I need to work out because my life is not my own. And even when we think about chronic illness and diseases, we have to realize that our life is not our own, right? We are designing and creating something that will be passed down through the generations. So what both of you ladies said just about the whole idea of, oh, it's about me, like my life is not my own. Like you said, Dr. Maddox, your mom's story impacts you and her chronic illness impacts you. When I go to the doctor, I have, like you said, I got all that in my family. Check, check, check. If we was in school, I get A+, but maybe not. I would really get an F. Because my report card, when it comes to this, on size of my family, check, 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 check. But it's not a good thing, right? So I think about that with my daughter. My life is not my own. It impacts us, and we didn't talk about it enough. And I think that's important, and that's why we're here today.
Absolutely. And we don't just pass our genes onto our children or to our families. We pass our dietary preferences on as well. And so, when I grew up, when people were happy, they ate. When they were sad, they ate. When they broke up with somebody, they ate. When they went to a funeral, they ate. When somebody died, they brought food to them. And that food was, it was the good stuff, right? And so we show, particularly in our communities, we show our love by feeding you. If you go to someone's house and you didn't accept food from them, that was disgraceful at times. So we show our love through those things, and we're passing even our preferences on to our children. And so, as we're talking about chronic kidney disease, you can't have that conversation without, as Keith Fletcher talked about, without thinking exercise in terms of prevention. And you also can't have that conversation without thinking about diet and smoking and the kinds of things that increase your risk factors for it. So now all of us are in different caretaker roles for that. And then some individuals on here, I said diabetes and you thought type 2, but there's also diabetes type 1 as well. And the one thing that I've noticed when we talk about chronic kidney disease is that there is a lot of guilt and shame associated with it, because many times people think, well, you brought this on yourself. And they may not have empathy for you because you brought this on yourself. Can we talk about how to be supportive without attaching labels that guilt and shame people as well? And I see you unmuted, Marquita.
Yes, that is such a important place to start. I think with anything, any change that we want to make in our lives, how we view it, how others view us, and how we feel about our ability to make those changes are critical to our success. And so I've heard some really good things so far. Just backtracking a little bit to what Dr. Slater was saying about how um, you're there, how you're one of the first people, and you said it too, Dr. Maddox, to notice that there's something going on with someone and probably the first person to notice that they have maybe some kind of chronic illness. Not might not even be kidney disease, but a chronic illness like diabetes or something like that because it's presenting in this certain way. And the thing, the I think the first thing that we need to recognize and focus on as it relates to chronic illness is uh, not blaming ourselves first. In that, when you accuse yourself and you have that lens on, everybody that you encounter from that point with you will have that interpretation. You'll have your accusatory ears on, as as you could put it. And it's so important that you recognize in that moment what's done is done, even if it is my fault. Let's just play that game. Even if it is my fault, what's done is done. You can't go back and erase or change anything. You have to deal with what you're dealt, right? So you start today with recognizing this is where I am and what can I do about it. Because you can control what happens from this point on. How you feel about it, how you think about it, all those things. If you cannot, then there's some other ways that you can get some supportive resources and things to help you through that process. But I think the first thing is setting yourself up for being able to cope with your situation. There's so much that goes into that, and that's such a a simple statement to say, but a big thing to be able to do. And as we talk more about the topic, I definitely want to get into that. But I wanted to also revisit the main part of what we're talking about, which is chronic, which means recurring, which means it's gonna keep happening over and over again. Uh, it's gonna be with you daily. So, with that being the case, if this is something that can cause you to feel sad, hopeless, nervous, worried, panicked, and it's gonna be with you every day, odds are, and I encourage you because you can do what you want, but I encourage you to really make it a priority to figure out a way, as you've already put it out there, to live the best life that you can. So, as we discuss the topic today, I do hope that I'm able to provide you with some tips, some coping skills, some things to consider as it relates to that. But I do want to say the first step is accepting things are what they are, because this is the thing, accidents happen every day, right? So let's say I get in an accident, it's a car accident, it's an accident. Just because it's an accident doesn't mean that the consequences of it will be less because it's an accident. So major collision, that's what we're gonna call it. Whether I am the person who's at fault or the person who's not at fault, the accident is still what it is. The factors are still what they are. We still got to deal with how to put the pieces back together. That's kind of how you have to look at this situation here. Okay, yeah, maybe you're the at fault person, or maybe you're not. That's not the focus. The focus is what are we going to do to get me back on the road, get me put together again, um, get me feeling like I can drive and be okay. That's kind of where we are with this situation and how I encourage you to look at a situation like this. It's not about what's at fault. It's about how do we deal with what we got going on.
And so, what I heard you say is, regardless of how you got to this place, your fault, accident, the consequences are still the same. And so, let's now practice some grace. And I would say, with that, one of the things you said is the way you present it is the way others will receive it. And I think I would add to that, as you are then choosing your support system who will support you through this process, make sure that you are choosing people who are not going to batter you through the process, people who will not enable you but not batter you. So you do want people to help hold you accountable, but sometimes right after you find out that you have certain conditions, there is this grieving
Yes.
of the diagnosis, number one. And so finding your tribe, which might include therapists, which might
Mm-hmm.
include coaches, which might include people who are encouraging to you, which should include people who are encouraging to you,
Right.
perhaps a part of your faith community, but identifying that group of people who will work with you, who will support you, who will encourage you is key.
Right. And can I add just one more thing to that? Um, I think you've already brought it to the surface about how important it is to have people who are supportive of you. Now, I have supportive people in my life as well. And a lot of them, my biggest support is my family, right?
Now, before you talk
However,
about your support team, tell us why you have a support team.
I because no man is an island, but
Okay.
more specifically, um, I was born with type 1 diabetes, so I've had it since I was a child. I have an insulin pump that I use to sustain my life. Lots of technology because I want to be well. And I could not have gotten to this point in my life if it wasn't for my family. Some of the key things that y'all have touched on, and I'll come back to the other topic. Key things that you've touched on through this process has been the importance of going to the doctor. Oh my God. Now, I was diagnosed when I was 8 years old. I have gone to the doctor literally every 3 months since I was 8 years old, and I might be close to 40. And I thought at one point, maybe a year ago, I said, you know what? I realized I have not really just missed a doctor's appointment before, unless I was sick or something. But I've never. I said, you know what? I'm gonna miss this appointment. That's what I said. And so, I called. I canceled the appointment, and I'm sitting there and I'm thinking, and then my mind starts to go, and I say to myself, now the people that don't go to the doctor, what are they like? And that same day, I called my doctor back and I said, I need an appointment because the best way to cure something is not to get it in the first place, right? So, going to the doctor is very important because I remember the first time I saw my eye doctor. He said, Marquita, as long as you keep coming to see me every year, you don't have to go blind. Now, when you have certain conditions, especially when you grow up in the south of Arkansas where there's not a whole lot of health care, and they tell you you got the sugar, you got diabetes, and you really don't know what that means. But at that point, because I'm a child, I think that means I'm gonna die in a few years, right? That's I had convinced myself that by 21, probably not gonna be here, right? So I'm going on, and then I started developing a team. Now my family kept me in the doctor, which kept me healthy. Okay, great. Had I not done those things, or they not provided me my medicines that I needed, kept jobs that allowed me to have good insurance. There's so much to this and not just being a physical or emotional support, but also there's other factors that go along with that. So having all of that support brings me here today, right? And then I got to the point where, okay, wait a minute, I'm 21 and I'm still here. And then I realized, on average, 10 out of 10 people die. On average. At some point, we all gonna face it. What I need to worry about is how I'm gonna live, right?
Oh, wait a minute. That
Mm-hmm.
is tweetable. How am I
Mm-hmm.
going to live?
How am I gonna live? Because that's the part that we got to figure out. 10 out of 10 people, I don't know how it's coming, but it's coming,
Uh
and I don't
huh.
know when it is. And 21 let me know. Okay, I done beat it past that, and so the doctor said if I keep coming, he can help me prevent some things. So I'm gonna keep doing that, and then if you catch something early, and Dr. Slater touched on this earlier, you don't see the symptoms. It's a silent disease, so you don't see the symptoms until you're more advanced in stages. But if you go to the doctor every year, or you come back when they tell you to come back after you try the medicine, and if it don't work, you call them and say, "Hey, this is not working for me." Not just stop taking it and talk about Jesus will fix it.
Uh oh. She
I'm just
brought
saying.
Jesus in.
I'm just saying.
All
So
right.
if you stay in contact with your team and develop that relationship, and then pick people you trust, there's so many things I can talk about when it comes to this. But you
Well, we're gonna
can
have to
be
interrupt you and let
successful.
somebody else talk too. You
I
doing
mean,
good, girl.
what she said was so good, and what it made me
All
think
of it.
about was putting your like every day for your entire life and making the decision to put yourself first. And
Mhm.
so going
Mm.
to the doctor consistently, you are choosing to put yourself first. And so
Yes.
because we have our stories, but I have family members and close friends who have dealt with it. But every day, what does it look like to make the decision to put yourself first, right? Often we want to take care of everybody else, but we've heard that, that age old, putting the mask over your mouth first. Like, what does that look like before everything else? Every morning I have a decision. Some people would say it's selfish, but I think it's selfless to put ourselves first and to ourselves where we are. And I think that's one of the things that you said, like, be kind to yourself, love yourself where you are. Today doesn't look like yesterday, and it won't look like tomorrow, but being kind to ourselves first and putting ourselves first every day. And what does that look like, right? So sometimes it means doing the opposite of what I feel, but putting myself first means that I do the very best job that I can to make myself a priority. Understanding all of the things that come with
Mhm.
us, the baggage that we bring, right? It's not like we're just going to wake up the next day and be able to hop out of bed and do 50 push-ups and run 5 miles. But maybe today putting myself first means, I'm going to stretch a little bit. I'm going to drink more water, but just consistently making the choice to put ourselves first so that we can make sure that we do take care of others down the line. But that's what I heard from you. That was a testimony, girl. Listen, I ain't to give you an offering, honey. As I like to
Already?
say, that'll preach. That'll
Yeah.
preach all day. Wow,
Yeah.
that's an amazing.
Yeah. And then
Absolutely.
I also want to share that something just about piggyback on something you said, which is doing the opposite. Okay, so sometimes you cannot figure out what to do, but don't do that thing you don't need to do. Like, do the opposite. And so sometimes it boils down to that. Another thing that I often consider for myself and encourage other people is that do the best you can. The best you can is not perfect, but it's the best you can, and nobody can argue with you about that. And so when because I have lots of doctors, I go see them oh my God. But I go see my doctors, and the thing about it is I make sure I have people on my team that suit me, that fit my personality. I need to know
Mhm.
the truth, and I like information. And I may be wrong all day long because I've Googled and researched and I like to read. And I have decided that I should have this treatment plan, doctor. And what I do is I have doctors who listen to that, and when they're done listening, they're like, "Okay, Marquita, that was nice for you to share, but that's not what we're doing." And I'm gonna tell you why. And I get the information that I need. They have listened to my input, and then we can move forward together because we have built that trust. I had one lady who was new, and my doctor was out, and she changed the settings on my pump. Um, and this is what gives me the insulin that I need, right? So she changed the settings on my pump, gave it back to me, and told me to have a great day. Not only did I not have a good day, I didn't have a good next 3 months because for me, it's important for me to have control. This lady changed my life sustaining pump without going over it with me. Like, I'm not gonna turn over my health, and that's not what we said to do either. You need to have partners in health, and so I went
Mhm.
back to see her because follow up or whatever. And she was like, something's going wrong with your blood sugars, Marquita. They're just high. She said it has to be something emotional. And I was like, Lord, I don't want to bust her out. But she keep asking me what's different. And I said, ma'am, it's you. You changed my pump without telling me, without consulting me. And now I feel like I can't trust you because you won't consult me about me. So I said
Yeah.
all that to say your support team needs to not just be your friends and family who may, you know, they have your best interest in mind, but they don't technically know all the time what you need. And y'all are in the same family, so you think alike. But you also need a support team that you can have in your healthcare where you can be transparent and be like, you know what, doctor, I ate 10 slices of pound cake today alone. And it's been a thing. Or, doctor, I get up and I'm comfortable with doing this. Doctor, I've been sleeping a lot lately and I get up at 3 o'clock in the morning and I have my dinner then. I'm not gonna lie to them because she already seen it in the labs. Y'all are not chicken. You
Listen,
just have to keep going
listen.
on.
Yes, that is a whole word. Okay. Do not go to your doctors and lie. And then when you are angry with us, we know you angry with us. We
Yes,
can
they
feel
know
your
you
vibe.
lying.
Just let us know. There have been times when I have said, I sense I sense a disconnect. Am I imagining that, or is that, so I will say that because that's who I am, and how I am. But what I need you to understand is that you have freedom of choice, particularly if you're in a metropolitan area. Maybe not so much if you're in a rural area, that you may not feel like that, but you have freedom to choose another provider. But before you choose another provider, what I will say is use your voice. Use your voice, and do what Marquita did. You the problem. You may want to use a few different, you may want to phrase it a little different, but I didn't appreciate, and what I will say is, don't wait 3 months to do it. Like, say that I need more information. Why are you doing that? Let's partner, and use the word partner. We get partner, but use that word. You use partner, use team. We're in this together. Educate me. I am a highly literate person. I get it. Help me out. And if you're not highly literate, say, explain this to me like I'm a third grader. Okay. So that I can explain it to my third grader. But I love that. There was so much packed away in there. But I'm going to settle it on this point. Don't lie to us. Tell us the whole truth. Tell us your truth. Uh, Fletcher, Slater, you look like you wanted. Fletcher, I think you're
Well,
unmuted.
listen, because my wheels are turning, because like those phrases, I'm finna use that like in every aspect of my life. Like, I sense a disconnect. I want to
Yeah.
partner with you. Like,
I love it. I love it.
I really love those. It's like, okay, you mad, huh? I see you mad. That is, you mad.
See, I didn't even say mad. I said disconnect.
I know. Oh,
You can say
Translation.
yes to that. If I say, "Are you mad at me?" then maybe you feel a little intimidated,
I
saying,
know.
"Yeah, I'm big mad," as Marquita might say, "I'm big mad." But if I say disconnect, then you can jump in, and then you can tell me if you're mad, if you get around to it. But the point that we're really trying to make is that you should feel safe enough with your doctor
Mhm.
to disagree with them, to say, I didn't appreciate when you said that. I don't think you interpreted what I was saying in the way I intended it. You should feel comfortable enough to say that. And if you don't, perhaps you should ask for referrals. One of the things I'll do is I will say in our very first meetings, I will say, I, I will give them 3 other names of people that I trust who are psychiatrists. And I will say, I want you to get, because all doctors are not created equal. So if you choose not to work with me, I want you to have 3 names of people that I deem competent and compassionate, because you can be competent and not compassionate, and it's not a good fit.
Right. Right. It's interesting too. Just in considering what you said, um, when I often work with different individuals, mostly veterans, at this point, um, I always try to tell them like this. Everybody's not your flavor, um, and so it doesn't make you wrong to like something different. It's just a different taste. And
Mhm.
the other part about it is what blows my mind sometimes, because everybody's worth love. But I do
Mhm.
feel like there's some extra grace people that sometimes we have a little more. It takes a little more effort to love them in the same way and manner, and that person is somebody else's favorite, right? So I always consider that when doing that. My thing that I may not like the most, or I really appreciate tough love. If that's not what you need in your provider, then that's fine. Find you somebody, or partner with somebody, or like, you'll be surprised how many times I've had to be referred to somebody else. And I always tell my doctors, my mouth. And so I need a provider that can handle that.
Yes.
Even when I'm wrong, I need them to listen to me, because I feel like I know that I'm the expert on this body, which I am, but I don't know everything about everything. And so I let them know I need a provider that's going to be able to handle this. And every single time it said, oh, I know who to give you to. And
Mm-hmm.
10 out of 10 times I have been satisfied with who I have. So
Mm-hmm.
just be upfront. Ask the doctors, ask the nurses. Oh, receptionists are the best. You ask them, hey, which doctor should I do you think I should talk to? Even if you're just reaching out on your own, you call and you say, hey, I'm this kind of person. What doctor would you recommend? You're your friend. I'm just for real. And they be like, girl,
Mm-hmm.
let me tell you, Dr. So and so is so and so and so. They're gonna tell you. And so you can always get what you need. Just open your mouth. I know I'm talking a lot, but I want to back up one more thing about when to know you need to go to the doctor, right? Now we're talking about mental health wise. You got the chronic illness, chronic kidney disease, whatever you're dealing with. But how do you know you need to go to the doctor? Um, the most important thing that I wanted to share is if you just feel like you put what you could in it and you still can't lift yourself up, you still can't, you feel like you can't put one foot in front of the other. You feel like, oh, I really like watching my show, fill in the blank, but I don't really care that it's on today. And I haven't cared in the last 2 weeks. Or if
Mm-hmm.
I really like hanging out with so and so or playing this game on my phone and you really don't care, if you start thinking things like, you know what, if I wasn't here, my mama
Mm-hmm.
would say $200 a month on the,
Mm-hmm.
if you're thinking like that, that's a sign that you might need to get some help, right? You might need to call somebody. Um,
No, you do
what?
need to, not Mike. You do need
Yeah,
to.
yeah. Thank
Yeah.
you.
Yeah.
Clarifying. Directly say you need to call somebody.
Absolutely.
If you're worried, if you're so worried that um, you I mean, won't even make the next step, or not sure if you should take your medicine, or you're what I call catastrophizing. Everything you think of ends in death. You need to call and get you some help.
Mm-hmm.
Um, what we say is if it's impacting your ability to function at home, at school, at work, and people are saying, Marquita, you're just not yourself. Yeah, sometimes you can find that you're having more conflicts with people.
Mm.
Those are signs that you might need some help. Just throwing that
Those
out there.
those are some excellent signs. Dr. Slater, I see you unmuting.
Yeah, she has perfectly described you are experiencing anxiety, you are experiencing depression, you're experiencing irritability, and you're experiencing those symptoms enough that they are impairing your functioning. So, generally, you're way down the road on that list before you come to see a psychiatrist. And when you do come to see a psychiatrist, and I diagnose you with a mental disorder, then you have to deal with another issue, which is the stigmatization that you are a psych patient and you have a chronic illness. So, one of the things that happens in my practice a lot of times is I end up being the person who educates my patients about what kinds of questions, what kinds of things you need to say to your medical provider, because we're all in this situation. Everybody's very, very busy, and they're trying to rush you out within 10 minutes. Well, I strongly suggest that as issues come up, you keep yourself a little notepad and you have those questions ready. And the other thing that happens in my practice is you've gone to the doctor's prescribed you a new medication. You're coming back and you're asking Dr. Slater, what about this medicine? The doctor, you don't remember, and I'm not going to say the doctor didn't do it, but you don't remember the doctor saying how this medicine was going to interact with the medicine that you may have already been taking from me. And I'm just going to do a wonderful example. I think lithium is kind of the example for almost because it's a medicine that we use for so many things. You know, we use it for bipolar, and we use it to treat depression, treatment resistant depression. And then there's all this recent literature that is actually supposed to reduce the frequency of suicide. So it's used very common. Now, lithium works on both sides. It can cause kidney disease. And if you've got kidney disease, it's going to be hard to get it out of your system. So your doctor, if you've got kidney problems, your doctor really needs to be taking some time to explain to you what's the impact of what's going to happen. Plus, if you're taking psych meds, what's the impact of getting dialyzed? Is that going to take that medicine out of your system? Plus, if you've got kidney disease and this medicine is cleared out of your systems only by the kidneys, has he talked to you about the fact that you might need to change the dosage now that you've got kidney problems? So there's so many things to consider. And the main thing is, it gets back to what Marquita says, you have to be willing to talk to them. And I don't care how uncomfortable it feels, you have to be willing to talk to the providers.
Dr. Slater, if I have a problem with my medicines, what should I do first? If I feel like I'm having side effects, what should I do?
Don't throw your medicine. Don't stop taking that medicine. I love that question. If you have a problem with your medicine, who can help you with that except for the person who wrote the prescription?
Yes, ma'am.
And of course, obviously.
Second thing, what if I have a thing about generics? Like I really like taking name brands, and my doctor keeps prescribing these generics. What are my options for getting assistance with that? Like I know there's social work stuff I can do, but it seemed like I might be able to talk to you about it and you help me in some kind of way.
Two things that first came to my mind. The first one is whether or not you can get a generic or brand name may be up to your insurance company. That may not necessarily. Second thing is there are some medications that we do know that the generics don't work as well. And because every human body is different, the generic may not work as well for you as it worked for someone else. And your doctor can actually say brand name only. When he writes the prescription, he can say brand name only.
And then past that, if the doctor has done all they can do, then you have the social worker who knows that, okay, well, maybe you can call the company that makes the medication. They have an assistance program that you can get signed up for, or they will send you free stuff based on whatever criteria that you need. There's so much more, but not taking the medicine is not what you need to do.
And Marquita,
Absolutely.
do you know how important it is to have a treatment team? Mental health was one of the first branches of medicine that understood that the doctor can't do it all by himself. And I'm so glad you said you have a social
And by
worker.
herself. Women's International History Month. I just want to throw that out there. Now, this has been really, really good conversation because here's the thing. So many, yesterday I had a young man who was probably 15 years old tell me he no longer wanted to be on his medicine because he did not want to have kidney disease. Now, he was only 15 years old. And listen, he was in a detention center. But in that detention center at 15 years old, I don't know what had gone on in his family that he had the foresight, the insight, and the wisdom to say, I don't want to take this medicine because of my kidneys. Now, it was one of those medicines that did not impact his kidneys. And so I was able to say, I'm so glad you brought that up. Do. And he agreed. And I stopped the others that did impact his kidneys that didn't matter anyway. It was just a little trazodone. I stopped his magnesium that he had requested, he was on, and stuck with the medicine that he actually needed for his mood. But how impressive is it when, for that young man to say that? But I will say to you all, when you go in and you know that you have kidney disease, do ask your doctors, is this broken down in my kidneys? Because my kidneys are already burdened, they're already taxed. Is this now? Ellis, I know I saw some questions, but I don't see them. They're not popping up, so I can't see them. So there are some people who are asking some questions. Family, we're not ignoring you, but I can't. Ellis, share some questions with us that's coming in. We appreciate those of you who are dropping your questions. If you're just coming in, I want you to know you've missed it. Share it so you can go back and watch it again and hear the wisdom of those who are living and supporting. Now, we're going to answer this question a little bit, because just a little bit, I started juicing. What is the best ingredient you recommend for inflammation and weight loss? I will tell you that not a one of the people on here is a dietitian or a nutritionist. So what I share with you is not expert opinion as it relates to me. I will say I really like ginger and I really like turmeric, but that is not an area that I delve into deeply. And so I would encourage you to talk to it, particularly if you have kidney disease, and I think that I saw that you did, to ask to be referred to a dietitian who works in that every day, all day. Your physicians are, I don't want to say we're the worst ones to talk to, but I will say that unless we have been intentional about that, we do not get a lot of training in that area. And so the stuff that we're going, I love Mediterranean diet type stuff, meaning olive oil, which you're not going to put in a smoothie, I suppose, but pineapple, ginger, turmeric, kale, spinach, those types of things. And I know that you had a couple of things, but Key, I think I saw you unmic for a minute.
Well, I was gonna say, Dr. Maddox, you may have a career in nutrition and wellness. I definitely agree with you. As always, consult your physician, but definitely nuts or oil, leafy greens, avocado, those types of things are really great for inflammation. Turmeric is like number one. Turmeric, even just a little bit of turmeric, if you're juicing or you're doing something like that, those things are great for inflammation. But always consult someone who is an expert in that area and check with your doctor.
Because the one thing that we don't want to do is then to have your glucose spike, because all smoothies are not created equally, and you definitely want to have someone who can talk to you about your macronutrients, your protein, your carbs, your fats, those kinds of things. um, Now we are getting to the end of our show here. And so I'm going to say, as we are talking about living life like it's golden, I want you to share two or three strategies with our audience as takeaway. We've heard everything from choosing your tribe, putting yourself on your list, choosing yourself first, those kinds of things, talking to your doctor, making sure that your doctor understands that she, during Women's History Month, is a part of your team. You are employing her, and not to be obnoxious, but I say that because I need you to hear it so that you understand that you're not married to the doc. Maybe you taking the doc out to coffee, and if it's not a good fit, you have the option to get another one. But now, Keith Fletcher, you and I talked a little bit about the transportation side of this, because when I was growing up, we heard stuff like, "It's my thing, do what I want to do. You can't tell me who to sock it to." But and we have this fierce independence. But what we realize when we have chronic kidney disease is we are not independent; we are interdependent, and your loved ones will make great sacrifices to support you.
Absolutely. And I think, again, that my life is not my own in terms of the things that we pass down, but even in terms of the things we pass down to those who have to help take care of us. And so I do have I love when I have a brother who actually suffers with chronic kidney disease. And when he came back to Arkansas, because we were originally from New Orleans, go Saints, and so we had problems with transportation because a lot of the clinics it's very early in the morning, and where we live is quite far, and so there was not a way for him to have transportation. We called several places and tried to get different shuttles, and they would only take him to a certain area. And so just our family coordinating of trying to get back and forth to taking him to dialysis, getting our son work, and then what was he going to do once he finished dialysis? I mean, some he just had to sit across the street or try to take the bus, but didn't even provide transportation to where we from the dialysis clinic. We know a lot of the clinics are in our neighborhood because I guess they figure that's where the black folks that's where we are. So a lot of times they're in our neighborhoods and we don't necessarily live in that area. So it became a struggle and a stress on top of everything else. Even thinking about him, like we said, it's difficult sometimes to ask people, be hating, don't be hating, to ask people for help. And so not only was he having to ask for help in terms of his health, but even transportation and even him feeling like a burden because he couldn't get out there. And even when he tried to get outside transportation, it wasn't provided. So what do you do when you try to get transportation? Y'all know where we live. Ubers and things are not that easy and they're not cheap. This wouldn't provide transportation. Some of the uh, medical places would not provide transportation. So what do? When you're suffering and struggling and there's no way to get where you need to get in order to get treatment. And so that was definitely a stress on the entire family.
Mhm.
Just to comment on that a little bit, because I'm a social worker, a helping professional, and I've got to just chime in and say, when things like that are going on, always consider what you're dealing with in organizations that support it. So if I have type 1 diabetes, consider that organization. You got chronic kidney disease, consider that organization. Consider the people who want to help in the community, like churches, organizations that you may belong to. So if you're in a sorority or a fraternity or something like that, if you have transportation issues, you also have community organizations that can help you. But what I will also say is that the main thing and one of the I think more untapped resources are those places like the Juvenile Diabetes Association or the Chronic Kidney Disease. I think that's one of them that I've seen listed. Um, Going to those organizations, they sometimes have funds for transportation because the point is for you to be healthy. Um, some of the things that just when it comes to affordability and access. Um, I may or may not have had times in my life. I'm going to be very straightforward, honest. I have had times in my life where I did not have insurance. I'm 20 something years old, and insulin is 100 and 200 some dollars a bottle, and I don't use just one bottle a month. Nobody thinks
Mhm.
about that. And so I had to resort to a lot of creativity to make it through that. And I didn't want to bother my parents, and not everybody's parents are millionaires, and so I had to figure out some ways to get those things done. But you just remember, like I told my doctor, hey, doctor, I'm having some problems affording my medications. They may or may not be able to write some extra prescription or give me more samples, or I mean, they always have samples, or calling the place that orders it. Or I know, like in Palm Bluff, where I grew up, they used to have a program. They may still have it, where you can go up there and you go to the pharmacy and tell them that you can't afford your medicine. They would like literally give you the insulin for $5. So it's what I needed, and I got the need met. And so I say, be creative. And I know the question was asked, so I'm going to have to speak while I'm speaking. What would I leave with the people today, or what key points? Number one, go to the doctor. I want to say 99% of the time, when I've had something serious to happen in my life, the doctors have said to me, well, you caught it early, Marquita. Good thing for you. So I can see today, and I've had several surgeries because I keep going to the doctor. And when they tell me to come back, I come back, and it keeps me well. And then I don't sit here and worry about, am I going to be okay? Because if I'm worried about being okay, I'm going to take myself to the doctor and I'm going to check, and they'll be able to confirm that I'm okay, and I go in peace. So that's number one. Number two is start where you are. You okay? So you're intimidated. You feel like you can't talk to the doctor like I talk to people. You feel like you can't talk to the nurse like you talk to people. You start where you are. So you feel like the lady that answers the phone is your home girl. You call home girl up and be like, "Hey, girl, I need some help. What do I need to do?" 9 times out of 10, they're gonna know because they filter all the information, the stuff that you sometimes don't get, or oh, I really need to see somebody, girl. I'm feeling sick today. Would you want me to get you in to see Dr. So and so? He'll always see you and he'll help you out with, or Dr. So and so, she will, and can throw that in there for Dr. Maddox. And then the last thing is Just don't get stuck in your situation. What I mean by that is, real short story. I was so challenged with the fact that I had a new autoimmune thing to happen to me because they come in pairs. It's like a family. And so I had a new autoimmune condition that came upon me, and I was frustrated because I couldn't walk like I wanted to. So I'm stuck in this house, and I can't walk like I want to. I used to work out 5 times a week before all this happened. Uh, I was poolside ready at all times. Like I really, and so I couldn't get around like I wanted to. And I was really frustrated by that. And then my job says, well, you got to come up here for this training. And I'm like, but the people haven't seen me since I've been like this, right? So I'm so stuck in my head. And I'm me. This is me every day. This is how I am. And so I was like, I'm going to go up here. So I went up to the job and I got more joy and energy. And I can't even walk. And so I realized in that moment, we were romanticized and say, oh, everybody's living a better life than me, unless you get out there and see something different than your situation. So don't get so stuck on yourself that you feel like, oh, woe is me, and everybody's living life like it's golden. When really, we all live in a golden life. Everybody has a thorn in the flesh to buffet you, to keep you humble. And so 10 out of 10 people got problems. So your problem may just be your problem, but at the same time, 10 out of 10 people are dealing with something. I don't know, somebody that's saying, "Oh, y'all giving me too much money, don't give me no more," or "Oh, I just feel too good. Can I get a heart attack?" Like nobody's saying these things, so we got to be realistic with ourselves. So don't stay stuck in your situation. So when I got up and I was walking those halls real slow with one of my nurse co-workers helping me down the hallway, and I'm having to sit down every 10 feet and breathing like I'm running a marathon. I'm smiling like I can't believe this because so people are so focused on what they got going on that I realized Marquita can't walk. Nobody noticed I couldn't walk because you're so worried about whatever you got going on. So I said all that to say, be nice to yourself. Everybody's got something going on, so be kind to others and just do the best you can. And it will get better if you wanted to. Because you gotta, I mean, whatever you focus on, that's the direction you're gonna go on. So you want to end up where you want to be, you better look at your goal.
All
Or
right.
you're gonna end up where you are, which is negative and stuck where you at. So it's up to you. That's all I'm gonna say.
Marquita Maxfield has laid it all on. Catch it early. Tell your doctor when you don't have any money and you can't afford your medicines. Tell somebody because somebody can help. Dr. Slater, what are your last great points, Marquita? Dr. Slater, what are your last points? And don't rush us. You take your time. You're muted, Dr. Slater. Unmute and take your time. Don't
All
rush.
right. Well, briefly, remember that you're the head of your treatment team. And having someone like Marquita give you all of these available options just helps tremendously. But your treatment team is not just yourself and it's not just your primary doctor.
Mhm.
Secondly, a morning wellness ritual is such a powerful thing to have in your life. And what is a morning? By that, I mean, when you get up in the morning, we know you brush your teeth and you take a shower and you put on your deodorant. That's for your physical self. But what are you doing for your mental health? I
Mhm.
believe that that needs to start with a period of meditation. And it can be a meditation on whatever you feel that you need to meditate on. Some people just do scriptures. Some people do meditation apps. Um, and after that period of meditation, after you calm yourself, then you think about the exercise. And the exercise, no matter, it needs to be 5 days a week. That's been proven over and over again. And then the last thing, you need to go ahead and map out what needs to get done. And if it needs to call in the refills for your medications, then don't wait until the last pill because they may not have that in stock today. So your morning wellness ritual. And my last point is, if your doctor has drawn your blood work, which he does, and not told you what the results are, then you are not being the head of your treatment team. Don't walk out of that office until you find out how your kidney functions are doing.
Excellent points. Excellent points. Keith Fletcher?
I don't know, these ladies, man, they didn't hit the nail on the head. This was so good. I think really overall is you have to break up divorce unhealthy habits. And I say if you've ever been divorced before, think about it like right, like you didn't just wake up and let your sweet thing leave. It took time to realize. And as my mama once told me, but when you ready, done, you know you're done. It's a process. So breaking up with unhealthy habits take time. It won't happen overnight. Divorce, unhealthy habits, a little at a time. And the fact it is definitely not a sprint. It's a marathon. If we think about it, some of the things that you ladies said is these are generational practice of unhealthy behaviors. I'm talking hundreds of years that we're dealing with. I mean, some marriages ain't but 5 years. We're talking about hundreds of years of behavioral practices. You can't break up with that overnight. It's going to take time. So give yourself grace, but over time, realize that you have got to break up with healthy habits and really what that looks like, right? If you divorce somebody, are y'all still in the same house? You still talk? I mean, like, what does that look like? So you can't have this stuff that's still in the bed with you. You can't still have this stuff in the refrigerator with you. You can't still, you're not checking their phone no more. Like all the things you do when you have a divorce, this is what you have to do in order to lead a life that's more healthy and productive for yourself.
Yes, I love it. I love it. I love it. And I'm going to say go in peace. And the way you make peace may be to identify a therapist, a licensed mental health professional, so that you can process your grief of having being diagnosed with a chronic condition. Go in peace. Make sure that you're surrounding yourself with people who will instill hope and infuse joy and courage so that you don't become dependent on others unnecessarily. Yes, there may be a level of interdependence, but if you can be independent to some degree and be able to do things for yourself, go in that direction and use your voice. Tell us what your needs are, and not just the people in your circle who can't do anything about it. Talk to people who can help you, your doctor, the receptionist, the therapist, the pastor. The pastor knows who's lonely and who may want to stay over and hang out with you, but go in peace. Family, I just want to thank each and every one of you for sharing your stories, for sharing your family stories, for giving of your time. I certainly want to thank our audience for staying with us. Please consider sharing this. Ladies, if you are on social media, share it with your team. And the reason I always say share is not for vanity's sake, so that you all can see, oh, I have this many shares. But this information is so good, and it may actually save the life or prolong the life of people that you love. So when I say share, it's not a vanity thing, because I know it, I got it. It is so that the people who need it can get that information. That's what we're all about here on blackdoctor.org, is improving the lives of not just Black people, but we're talking about the conditions that disproportionately impact us. And whoever you are, you can benefit from this information. I appreciate you again for tuning in. I want to encourage you always to step outside of your comfort zone and make an impact. Use your voice and share with others, so that perhaps while you are helping to support other folks, you can also help prevent some of those folks that you might be the caretaker of if they don't get this information. I'm telling you, it's selfish for you to share it. You share this so you might not have to do some of this stuff we talking about. Thank you, and bye-bye. Thank you, Ellis.